I am Dr. Sanjay Pandey, consultant urologist at the Kokilaben Dhirubhai Ambani Hospital in Mumbai. Friends, in andrology, it is important for us to be aware that one topic which touches men in their young, middle age and elderly age group is erectile dysfunction. Erectile dysfunction, or failing to maintain or achieve an erection that makes you capable in the bed with your partner, is a progressive phenomenon. It could happen just by graceful aging in 40s to 80s, or it could happen because there are multiple factors which contribute to erectile dysfunction. So if a man is not able to perform sexually, there are multiple reasons which happens around, and of which one important aspect of not being able to achieve erection, not being able to sustain erection, not being able to maintain erection are aspects which are quite bothersome. Many men actually find it very difficult to do this, to come to an andrologist, to come to a urologist and to speak to them and say all these things around. Unfortunately, a very common term called ED is being used in the country. ED, or erectile dysfunction, has got its own connotation. It's a part of the larger health. In other words, erection in the penis is a barometer of man's entire health. Today, it's taken as a vascular disease. That means men who have got vascular phenomena in their heart, men who have got vascular phenomena in their blood vessels, men who have got diabetes, long-standing or uncontrolled, men who have got atherosclerosis or high amount of lipid content and cholesterol issues for which they take medication, men who are smokers and smokers for a long time, which brings about a complete change in the whole metabolism, men who are very fat and obese, have got changes in the body happening around. And all these things would contribute, if not be causal, to a phenomena which is called as erectile dysfunction. That means men with all these phenomena, severe obesity, not everybody, but some and many, people who are smokers for long standing, who are diabetics, who have got atherosclerosis, cardiac diseases, blood pressure medications, diabetes uncontrolled, are men who are at risk of developing erectile dysfunction, which will only progress. It's not about a statue that stays static, it's about a progression which happens and goes downhill. So men in their 40s, 50s come and complain. Let's take some examples. A man in his early 40s who was good enough in his bed with his partner is finding his erections gradually going down. His erections are not very good in the morning. He gets up, he doesn't find that hard erection which was always there when he used to go to the washroom. So early morning erections are going down. Number two, when he performs with his partner at night, he is not able to achieve that erection which was hard and tense kind of a turgor with good tumescence in the penis that he could penetrate. He is not able to achieve that. When we question him and ask him, he says, I'm not a smoker, I'm not a diabetic, I'm otherwise a healthy lifestyle, do yoga, take some proteins, otherwise work and probably live for myself. I gather this is a common man. A common man in the society is progressively aging. He is not aware of his counterpart, a female counterpart, whose hormones are known best by changes in the hormones that is visible. The menstrual periods are hormone changes that women goes through. Men don't go through it as landmarks or as sophisticated dates which change around, so they hardly know about it. So he's finding this progression and has been sent by his wife to see us. When we examine him, evaluate him, talk to him, we know that he's anxious about this because he's progressively failing. Not that he has grown old. Early 40s is the time when he's in the prime of life, but he is going through this issue of progressive erectile dysfunction in the time where the erections are poor, they are soft, they're not getting aroused with foreplay and with capability that was always in the bed. And this is a very, very common phenomenon. This will progressively change as time goes by for him in his 50s, 60s and 70s. He knows it because he can see the change in the first 6 months to 9 months. That's where we need to evaluate. And therefore, an andrologist, me at the Kokilaben Hospital and our friends, do a workup and identify the risk factors, look at the hormone changes and bring them back from the pathway to the main road which he deserves to be in. Because other men in 40s, his own friends and his classmates and seniors are doing very well. So why is he losing this main erectile function? So loss of erectile function is a common, very demoralizing phenomena for men. And many a times they postpone this health because they know that they are very ashamed and shy to reach. And there's something which we need to be aware of. So to me, this is an important aspect which is completely silent. And many a times, if I would examine a male in his 40s to 70s, for some reason in urinary issue, I always ask him a question, is there any sexual problem? And he speaks loud and clear. There's so much happening, I'm not able to tell anybody, and we as a couple are facing it. So this is completely treatable. There are today various aspects of care in erectile dysfunction that an andrologist would look into. It's not about giving everybody one pill, one medicine, one injection, one tablet kind of thing around. So for us, the awareness drive needs to reach every home, needs to reach every young man in this country that erectile function is completely treatable. We are missing it out only because we probably are not aware and we don't know whom to go to. And when do we need to go? So if you have fever, you don't wait for long, you go and see your doctor. If you are bleeding, you don't wait, you go and see a doctor. If you have pain, you don't wait. But these are all acute, difficult phenomena which you can't manage alone. So you go and see your doctor in time. So in quality of life diseases like erectile function changing, like urinary leaking, many a times the shame, the taboo of the subject, people don't go and reach their doctors around. So the right doctor would be to you, an urologist or an andrologist in your city. In Mumbai, that we continue to see such patients around, it's important for us to wake up to a phenomena of erectile dysfunction from a good erectile function, which has progressively changed to a level where you deserve a treatment, needs to be taken care of. The quality of life improves when you're back capable enough. Otherwise, a lot of morale is down, a lot of capability is down. You keep thinking about it, keep rotating in, searching yourself where to go to, and then you reach somewhere. You get a therapy, you may not got a complete therapy because neither you could tell all, neither we could ask you everything. So it's a good concerted atmosphere of discussing all the problems and taking it forward. Friends, erectile function does change because it's a hormone-related change, and erectile dysfunction is a progressive phenomenon. With all these things contributing around, I think it's important for us to maintain our health well. So if we always do what we always did, we'd always get what we always got. We got to move forward and safeguard our health. And in sexual health, in erectile health, I think men lose their capability quite frequently. So important as progression with age happens around, we take this subject head on. We see our andrologists, we see our urologists in our cities, and we probably spill the beans, tell our story, look at our capabilities changing, look at what is our past treatment, and we study you forward. So I think it's time for us to look at our men's health portfolio in terms of progression of change. Somebody may have had all this for many years. Some 40s, if we just move to 50s and 60s, men have lost quite a capability. Some people may come for other complaints, and when we ask, they said we have not been performing for months or years. It's important that they want to reactivate, but they don't know whom to reactivate, how to reactivate. So then there are tests, there are medications, there's a progression, there's a lifestyle change. All those are a part and parcel of the therapy which we give. It is just not about treating only with medicines. So while you safeguard your health, it's important to safeguard your erectile health, something which is progressively changing, and for which we need to look into people in their 30s, 40s, in their 50s, 60s, and 70s. Younger men, late 20s and 30s, premarital, also have got erectile dysfunction. Many times it's an anxiety disorder. Many times it's anxiety of performance capability. Many times they've failed in the early days and they have a partner waiting. So these are things where we do a hand-holding journey and talk to them, explain to them, and bring them back to their capability by giving the right medications for a shorter while. Some people may require a longer dosage of medication. It is all about choosing whom to give what and to what time to give it. For example, somebody would need only a spoon of sugar, somebody may require 4 spoons of sugar. So teacher teaches everybody. Somebody actually would pass the exam, somebody may fail the exam. But somebody also gets a gold and a silver medal. So it's important for us to look at everybody gets the right approach to the right individual. So friends, erectile dysfunction, unfortunately with progression of age, is going to stay, going to progress, and our time is to probably safeguard it. And therefore, at the Kokilaben Dhirubhai Ambani Hospital, it feels proud for the last 17 years to be able to safeguard many men who have gone this issue of erectile dysfunction to very significant levels. Thank you so much.